Hey everybody, Michael Reese here, certified financial planner, founder of the Prosperity Planning System, all about helping you enjoy a prosperous life, at least financially. Today, we are going to talk about what do you do about healthcare expenses later in life. I know it's kind of a downer topic, but I promise you, you're going to learn a lot here. Make sure you check it out. All right, gang, healthcare expenses later in life, we got to figure out what to do about them because here's the reality. The reality is this: the longer you live, the more you use the healthcare system, right? Because our bodies break down. And, hey, what's happening to those healthcare costs over time? You got it, like going up like crazy. So here we go. We've got these escalating prices. They're going to be a lot higher later on. Like healthcare is going to be crazy expensive later on, just when you need it. What are you going to do to protect your hard-earned savings from those types of expenses? That's what we're going to talk about today. Now, before I dive in, you know what I'm going to say. I say it on every video. Click the like button below us. Give me a thumbs up, right, if you like this video. Comment, be nice, and of course, subscribe. And if you want to talk to me or my team on any of these things that we talk about in this series, there is a link below. It's called talktomike.com. It's our online calendar. You click it, you go to the online calendar, you set up a 15-minute introductory call. All right, let's dive in to today's topic. I know, you're looking at me right now, you're like, Mike, how are you so excited about, healthcare expenses later in life? I mean, I don't want to talk about getting sick. I know, nobody does, right? But we have to, right? Because we're adults. And you want to have that feeling of comfort, right? We talk about those 3 C's: control over your finances, confidence that you're making the right choices, and the comfort and peace of mind that you're going to be okay no matter what the world throws at you, at least financially. Hey, guess what? If that's what you want, we got to at least talk about this stuff, this healthcare stuff, right? Healthcare, top concern amongst a lot of people as they enter retirement. Maybe you're one of them. How do you address it? Well, here's the deal. Here's how it works, right? First, once you hit age 65, then you hit Medicare. And Medicare, I got to tell you, it's like the best health insurance program there is. You get a ridiculous amount of coverage for very little premium. I mean, I'm telling you right now, like, I think as I'm recording this, Medicare costs you, like $150 a month, give or take, right? Then maybe you get a supplement and a drug plan, and when all is said and done, you might be spending, I don't know, $250 a month, $300 a month, something like that. Probably not a whole bunch different. Call it $250, $300 a month. But it covers everything, and I mean everything. Like everything. You have like hardly any deductibles, and I mean it covers everything. My father-in-law, he had like triple bypass surgery, and I think it cost him like $50 or something, or $100 because it's just ridiculous how much you're protected. I mean, it's awesome. It is awesome. Now, financially, it's like a big Ponzi scheme, but our government can do that. It's awesome. But there is a big area, a huge gap that Medicare does not cover later in life. And this gap that studies tell us, this big gap, it happens to 70% of people who hit age 65. So 70% of people that hit the point where they're covered by Medicare, there's this huge gap that Medicare doesn't cover at all. Well, what am I talking about? I'm talking about the need for long-term care. Now, again, I just said long-term care, like, no, I don't know. No, Mike, I don't want to talk about it. I know. But hey, we got to be adults here. Let's talk about it. So what is long-term care? Now, I know what you're thinking. You're thinking, as soon as I say that, what are you thinking? Your mind, like my mind, I think about my 2 grandmothers, right? My 2 grandmothers, both of them had Alzheimer's. They were in nursing homes at the end of their life, like 7, 8 years. The last 2, 3 years of their lives, in both cases, like they didn't know anybody. I mean, when they finally passed away, it was a blessing. It wasn't a curse, right? And I'm sure you're probably like me. You hear that phrase, long-term care, and that's what you think of. And I'll bet that you know multiple people, family members, friends, neighbors, where they've blown through a huge portion of their savings, maybe all of their savings, trying to pay for care. But here's something you need to understand. Most long-term care is not delivered in a nursing home. It's delivered at home or assisted living. And I don't know about you, but someday if I'm lucky enough to live long enough where my body starts breaking down and I need care, hey, I don't want to go to no nursing home. I want to be at home. And the question is, Medicare, it doesn't pay for any of this stuff. So how are you going to pay for it? All right, 3 quick ways. There's 3 ways you can pay for it. If you, well, I'll call it 4. Number one, you can just use your own, you just ignore the whole problem. You just ignore it. It's not going to happen to me, or if it does, I've got a gun and I know where to use it. I've heard that before. Of course, at that point, you might have Alzheimer's. You don't remember where you put the gun or the ammo. But anyway, the point is, you could just ignore it, right? Be an ostrich, bury your head under the sand, and when the time comes, if you need care, you just got to pay for it out of pocket, and that's an option, right? An option is do nothing. But if you want to pay attention, you want to transfer some of that risk to an insurance company. 3 ways. 3 ways you can transfer risk to an insurance company. Number 1, traditional long-term care insurance. Hey, let me give you a little secret here. Traditional long-term care insurance, the insurance companies, they don't want to write it at all because they lose money on it. They hate losing money. They hate it, right? So got to watch out for that. It's really hard to qualify for. Premiums are going up, and once you have it, they keep jacking premiums up every year. Not really the direction people are going anymore. Number 2, this is very popular, what I'm about to share, life insurance. A lot of people are using life insurance contracts because you can use the death benefit in a lot of these contracts also as a long-term care benefit. So imagine this. You go out, you buy a $500,000 life insurance contract. You make premiums that are guaranteed to never change over your lifetime. It's always the same. And then you've got a $500,000 death benefit. If you do not need long-term care, that death benefit's paid to your beneficiaries, surviving spouse, family, charity, whoever. But what if you do need long-term care? Well, then you can use that $500,000 to pay for your care. Let's say you use $200,000 of it. Where's the other $300,000 go? Hey, to your beneficiaries. And it's beautiful. It's all tax-free. We see a lot of people finding that approach to be a very nice approach, one that they like to use. And then finally, number 3. So 1, traditional long-term care, nobody really uses it anymore. 2, life insurance with long-term care benefits, very popular. And 3, there are different annuities out there by insurance companies where those annuities have long-term care benefits to them. And the longer you hold the annuity, the bigger the benefit gets. So 3 ways to handle it, traditional life insurance, annuities, or what's the number 4 way? Yeah, bury your head in the sand, ignore the problem, and just say, I'll pay out of pocket, right? There you go. Now, what's right for you depends on your situation. You need to think that through carefully. If you want to talk to us, if you say, hey, Mike, can you help me figure this out? Just click on the link below. It says talktomike.com. That's a little link that takes you to our online calendar, 15-minute phone call, introductory call. We will make sure that you talk to me or one of the team that can help you out with that. But either way, I hope you found this informative. Remember, like us, right? Subscribe, leave me a nice comment, and make sure you share this with your friends if you found it helpful. Talk to you again on our next video.